It's coming up on 5:30 and time for our daily Two on Your Side Town Hall. We appreciate you being here on this Thursday. I'm Michael Wooten.
And hi there, everyone. I'm Heather Lee in for Kate Welshow for this afternoon. 849-2200 is the number to text. Ahead this half hour, hope and fear, two emotions taking center stage in the fight against coronavirus today as we wait for the FDA to approve the first COVID vaccine. That could happen at any moment. We're also going to talk with a local CEO who runs nursing home facilities where residents will soon get those shots.
And as we wait for the vaccines, hospitals are filling up. Our healthcare heroes are exhausted but continuing to save lives. We'll have an important conversation and hear live from a critical care doctor here in Buffalo who is on the front lines.
And a bit later, looking ahead to tomorrow's reimagined Tree of Hope celebration, Buffalo Mayor Byron Brown will join us live to talk about why this event means so much to him and really to all Western New Yorkers.
First up for us today, an extremely important day for America as an outside panel for the Food and Drug Administration is preparing to possibly provide emergency authorization for Pfizer's COVID-19 vaccine. I can tell you, I was just checking on this a moment ago. The voting may be happening, or at least we're approaching a vote among members of that panel.
Yeah, and awaiting possibly an NBC News special report if and when that happens. We'll bring it to you here on Channel 2. But in the meantime, government officials say there is an elaborate distribution plan already in place, ready for the moment the FDA gives the go-ahead. Now, when that happens, vaccines will roll out of Pfizer's deep freezer farms in the Midwest with a police escort to the main hubs at both FedEx and UPS. And then from there, they'll be flown and driven to every corner of the country, including right here in Western New York. The goal is to get every location get to all of those locations within 24 hours of the vaccine hitting those trucks. And as you might imagine, it is a massive logistical operation. And among those first to get the vaccine, nursing home residents and staff.
Yeah, a short time ago, I spoke with Chris Koenig, the president and CEO of Niagara Lutheran Health System. It operates 3 facilities here locally where residents and staff will be getting that vaccine in phase 1, and that includes the Greenfields Community Care Center in Lancaster. I started by asking him about the prep work that is happening right now.
So up until today, recently, it's been mostly, gathering information from the CDC and the State Department of Health. So actually, the Department of Health just had a call today with all the nursing homes in New York. So it's really been staying up to date on information as live as we can. We've had to contract with either Walgreens or CVS. We went with Walgreens. Walgreens has been keeping us appraised, so most of the ordering that we're going to be doing for our residents and staff is going to go through there. We do know that there's going to be some prep on our end in terms of collecting some documentation, consent forms, insurance cards for both residents and staff. Because really, when Walgreens or whatever pharmacy that your nursing home goes with comes in, they're going to give you 2 or 3 dates. So you're going to have to be very quick and very efficient, and you're going to have to make sure that you have as many people as possible ready to get that vaccine. So it is really important to make sure you have all the tools you need up front.
The governor had said previously that the vaccine could arrive here in New York State as early as this weekend, and so we would be looking at vaccinations beginning as early as next week. What time frame are you seeing specifically for your patients?
I think that's a really optimistic goal would be next week. From most of what I've been hearing, they're talking within the next 2 to 3 weeks. If it's next week, we'll get moving and make sure it gets done. We'll throw as many people as we need, as many hours as needed to make sure that that happens. Next week would be great. But more realistically, my assumption is probably, a few weeks because of the, just the storage and things like that, really change the logistics of how this can happen. So there's not many places that have the types of freezers needed to store this.
What are you feeling just, I guess, nerves-wise as we inch closer to this?
Well, I think nerves-wise, we're just as shot as everybody else already. So I think we're hoping for some sort of relief or reprieve here. We're lucky. We're glad that our residents are going to be first in line because they're the highest at risk. People over the age of 85 are 640 times more likely to have fatal effects of COVID than younger populations. So I'd say it's like kind of like a release of some of this anxiety, knowing that we may be getting through this relatively soon, because I can speak for the staff and the residents and families that it's beyond fatigue. They've done everything they possibly can, and this pandemic is still continuing. So there's certainly relief, I think.
And when you add up residents and staff within his company, you're looking at 800 to 900 people eligible to get that vaccine in short order.
Yeah, and you think of the logistics. That's one company. There are many in our region and all the regions of the country. So something to follow very closely as we look forward to this vaccine.
Yeah, a lot of moving parts there. All right, well, time now. We want to bring into the conversation now Dr. Manoj Maman. He joins us live. He is a critical care physician and pulmonologist with Kaleida Health, and we know that you are crucial in this fight against COVID-19. So we want to thank you so much for taking the time to be here with us today, Dr. Maman.
Thank you, Heather, and thank you, Michael, for having me to talk about this important topic.
Absolutely. Thanks so much. So you are going to be among the first here in Western New York to get the vaccine as well. We just talked about nursing homes, but we really need to vaccinate our frontline healthcare workers. What is your reaction? We thought we would have a conclusion to this by now. We thought maybe about 3:30 the FDA panel would give the go-ahead. They're still discussing it. I'm following one national reporter who's monitoring this. They may be approaching that vote right now. But your reaction on what is going to be a historic day?
I think it's remarkable that if you think about it, the first reported case of COVID-19 was in China back in December 8th of 2019. And we are here 1 year later with a vaccine available and pending approval for our nation. I think this is a remarkable event. We just have to be mindful that, as mentioned in the prior segment, there's a logistical challenge that we need to face in order to distribute this vaccine equitably to everyone in our society, those who are high risk, who are vulnerable to the disease. We have to make sure that we prioritize our efforts to make sure that the high risk individuals are treated as equally as those who may be more well off or more accessible to healthcare services.
And doctor, we know that the numbers are right now going in the wrong direction. More people hospitalized in Western New York, and you're actually treating many of those Western New Yorkers hospitalized with COVID-19. What do you think it's important for them to know about the vaccine? A lot of them wondering whether or not they should be concerned. What do you say to that?
Oh, well, I think the vaccine has been, the reports have been showing that the vaccines are safe. In general, vaccines are going through a very rigorous FDA process to ensure their safety. And I think that's still the case for this vaccine. And the reports about the vaccine safety is remarkable. It doesn't show that there's any higher risk adverse events than typical vaccines. The risks range from 0 to 4%, which is in line with other vaccines. And I think that Western New Yorkers should be aware that because of the safety processes involved with the FDA regulation, and also what New York State will further do in review of the safety data, that we should be confident in receiving the vaccine when it's available for us. We always should have a discussion with your physician because everyone's a little bit different. There may be some folks with medical conditions that warrant a little bit different monitoring. But that's a discussion you should have with your physician. Those who are healthcare workers or high-risk patients are already aware of these issues, and I think it's prudent that New York State prioritize these groups first.
Yeah, that's such great insight, and so great for us to hear that from you, from someone so trusted in the community, you and your colleagues. Heather just mentioned hospitalizations still going up. So we just got the local numbers within the past half hour or so. 20 more people in our region hospitalized with COVID today compared to yesterday. We're up to 537. It's never been that high since this pandemic started. What happens, even with the vaccine down the road now? What happens if we keep adding 15 or 20 more patients to our hospital loads day after day?
So, the healthcare leaders have been very adept at improving the capacity, the physical capacity of the hospitals that we have in the area. I think it's a very remarkable cooperation from different healthcare leaders and political leaders and private and organizations. But what we have to be mindful of is that there are a group of healthcare workers who are really trained to deal with these patients with COVID, especially the severely sick with COVID-19. And those individuals have been doing a great job. They're doing their best. They're doing a very remarkable job, given that we have started this epidemic here in the U.S. in April. Mm-hmm. But that vigilance comes at a price. You can only be vigilant for so long before that takes a toll on your ability to do more and more work. So I feel that the workforce is becoming fatigued right now. They're not showing it. They don't say it out loud, but I could tell that they're getting fatigued. And the physical work and the emotional work that goes on and taking care of patients with COVID-19 is definitely draining the workforce. So we have to be really mindful of that in the next coming weeks and months, that we have to try to flatten the curve so that we do not put undue burden on the healthcare workforce. I think we have to be mindful as we talk about capacity. Really, the thing that is the bottleneck for our healthcare system is the people in the healthcare system, right, who take care of other people. And as we know, we all are human, and we can have disease and other issues that afflict us. And for healthcare workers, the constant care and vigilance that you need as a healthcare worker can take a toll. And we have to have assurance that we have some type of way to flatten the curve and control how many people get infected, or we can overwhelm those people.
No doubt. Doctor, perfect timing. Thank you so much for joining us. We really appreciate it, and we wish you all the best. We owe you such a debt of gratitude. Right now, we're going to join an NBC News special report that started just a moment ago, as we believe we now have the votes in on that FDA panel looking at this vaccine. Let's listen in.
You should make the point. These are concerns, and there's always a concern about any sort of a drug or a vaccine. But the concerns are about 16 and 17-year-olds in particular, about adolescents. They want more studies on the effect of this vaccine on teenagers, on adolescents, also on pregnant women. Some discussion about those 2 cases in the UK where people had significant allergic reactions to the vaccine, but only 2 that we're aware of in an anaphylactic type of reaction. Some concern about doing more research on that. And then also about whether they should stop the placebo, those folks getting a placebo in this ongoing study. Stop that. Give those people the vaccine because, of course, it works. If you do that, though, then you undermine your science that you're continuing to try to pursue with the placebo and the full study. The bottom line here is that this vaccine is going forward. Americans are very likely to start getting vaccinated within days now.
All right, Tom, thank you. Let's pick up on that point. I'll bring in NBC Chief Medical Correspondent Dr. John Torres. John, what other steps need to take place before people begin rolling up sleeves?
So, Lester, like Tom said, the VRBPAC, this committee met. They're advising that when they go ahead and forward with the emergency use authorization, the FDA will now look at that, take that under advisement. Most likely, most experts predict they're going to go ahead and get that emergency use authorization. They're going to approve that. But then the next step is the CDC meets. They have an advisory committee called ACIP. It's the Advisory Committee on Immunization Practices. They're going to meet, and they're now going to go ahead and recommend who gets the shot, how much dosing they get, the interval between the dosing on that. They're going to make those specifics. Once that happens, the CDC will take that under advisement and most likely go ahead and recommend that as well. And that's when shots in arms will start, because now the authorization looks like it's going to go through from the FDA. But now after that, we're going to get clinicians out there wondering, okay, how do we do this? At what dosing? That's where the CDC steps in and gives them that information, Lester.
Dr. Torres, thank you. With today's recommendation of approval, and again, it's not the final approval, but Pfizer now faces the enormous task of manufacturing and distributing its COVID-19 vaccine. Gabe Gutierrez is at Pfizer's biggest manufacturing plant in Portage, Michigan. I know they have been waiting for the final go. It appears to almost be here. Walk us through what happens.
Yes, Lester, as you mentioned, this is the largest manufacturing facility for Pfizer, and it is at the ready. As Tom mentioned, within 24 hours or so of final FDA approval, the plan here is to begin trucks rolling out to different airports and FedEx and UPS are essentially supposed to split the country and distribute this to many parts of the country. But, Lester, it's an astounding logistical challenge because this vaccine needs to be stored at 80 degrees below zero. Now, states will get an allocation of this vaccine initially based on population. A large state like California, we understand, getting more than 300,000 doses. Smaller states getting about 5,000 at least initially. And while the timing of this is extremely fluid, we understand that some hospitals across the country are preparing potentially to get their first doses as early as Monday. Lester?
All right, Gabe Gutierrez for us. Thank you. All this coming at a critical time for this country's healthcare system, which is stressed to the breaking point by the latest wave of the pandemic. Steve Patterson is at St. Luke's Medical Center in Phoenix, and we pointed out a bit earlier, Steve, all this news coming on the heels of the deadliest day in this pandemic so far in this country.
Lester, here in Arizona, there is a crisis of capacity, which is really emblematic of what healthcare workers are facing across the country. Right now in this state, hospital beds at 90% capacity, ICU rooms at 90% capacity. The healthcare community is exasperated, they are fatigued, they are overwhelmed, and they're telling people to exercise vigilance even as this moves forward. I've been speaking to some members of the healthcare community here, and they say, one doctor I spoke to says she saw 36 patients into her urgent care, all 36 diagnosed with COVID. 4 of them had to be taken to the ICU on the spot. Obviously, the community here has been monitoring what's been going on with the vaccine. They're heartened to know that it exists, but they're also worried that the general public knows this knowledge and will become lax on following the rules. So they're also warning that it could take another 5 months for this to roll out to the general public here in Arizona, which is true for many states across the country. And they're again now saying that there is no better time to exercise vigilance than right now. Lester?
All right. Thank you, Steve. NBC News contributor Dr. Kavita Patel is a healthcare specialist who served in the Obama administration. Doctor, thank you for being with us. This feels like the cavalry coming to our rescue, but a reality check is probably in order here. Once the trucks start rolling, how many people ultimately will be vaccinated?
Yeah, it's a great question, Lester. And the estimates have varied because the United States government, through Operation Warp Speed, has pre-purchased doses. And you've heard Secretary Azar and others talk about having 100 million doses, which is 50 million people. But in these initial trucks and planes that are coming with vaccines, we're going to see probably about 2.9 million doses from Pfizer and about 12.5 million from Moderna, with the opportunity to have more once we have other companies approved. But as we just talked about, the vote today was for Pfizer's vaccine, and this is translating to millions of doses, not necessarily tens of millions or 100 million. That will take several months to come.
And Dr. Patel,
All right, we've been watching this NBC News special report. More coverage coming up at 6:30 on NBC Nightly News. But Heather, this is the news we've been waiting for all day long. As expected, this independent advisory committee recommending FDA approval. Still a few more steps to go, but this is a big one.
Yeah, a lot of eyes watching this very closely. We are as well. We need to take a quick break right now. We'll have more right after this.